to like email program directors or coordinators saying like, hey, I just finished my step 3 by the way, and I'm interested in whatever, right?
I'm guess, yeah. Though it won't be the same as recording.
Yeah, and Phil, can you send us the email, please?
We can't hear you.
Hello, everyone. Sorry for the abrupt delay, but thanks for bearing up. So, Ahmed, are you trying to share the screen?
Yeah,
Okay.
I'm just gonna start. Can you see it?
Yeah, I can see it.
Okay.
Okay, so we were at, can you go back to the previous slide?
Yeah, the difficult patient.
Yeah. So the difficult patient, I was trying to be fast at that time. I think we have time now. So they will ask you this question, like, tell us about a difficult patient, at least in some interview. So a behaviorally difficult patient is an easy to answer patient because, and then it would also help you with, knowing what you can at least predict what they want to hear. But when it comes to a diagnostically difficult patient, we come from a different training background, and sometimes
Dr. Rahil, you're breaking up. We cannot hear you properly. Dr. Evan, we cannot hear you properly.
Can you hear me okay now?
Yep, now we can hear you properly. Can you repeat what you said in the last 1 minute?
Yeah, okay, sorry. So I was saying that a diagnostically difficult patient is difficult to answer because the next best step in the US healthcare system could be different from where you have been working in. And hence, I think it's better to avoid it. I mean, you will eventually learn how to, manage in their system. But then right now, I think behaviorally difficult patient is a better chance or a better scenario to tackle. So I was giving this example of a patient who refused your treatment strategy. Okay, what I used to say, like, this is my example that, and this was also true, that a patient who who came to the hospital with like repeated tachycardia and recurrent tachycardia, and he was adamant that this was because of some cardiac disease. Now this patient had previous ED admissions with negative workup for any cardiac etiology, and I suspected that this was a case of anxiety problem. So, and I know that if I just told him that, he would not be compliant with it. So I knew that I had to spend extra time with the patient. This is the background of that scenario. That gives you an idea. Then what I did was, I again assembled the team. I called the behavioral therapist. I called, I discussed it with my senior about how I'm going to discuss my management plan with him. I'm going to ask him why he thinks it's cardiac. I will hear his viewpoints. I will tell him the risks and benefits of targeting it as an anxiety problem. And then that's what I did. So I spent, after a detailed discussion of about 40 minutes of telling him that we have ruled out all the infectious, cardiac, endocrinological causes. We have reached this conclusion by exclusion that this is a problem because of a panic disorder. And then we asked him about the different triggers, and he started opening up. And in that way, with using techniques of motivational interviewing and better communication, we came to know what was the real issue. And then we told him our treatment plan. The guy was really thankful that we spent extra time with him. We found his problem. And at the end of the day, he complied with our treatment plan. So that's what I used to say. So what I'm trying to say is that you have to use those words of, communication, motivational interviewing, someone who's non-compliant with you, and lead them through your thought process. Now, it is not such a big thing. Everybody does this, and I'm sure all of you have done this. But how you portray this and what words you use to describe that difficult patient will earn you points, because that's when they will tick those boxes, like communication, interpersonal, extra time, patient care, all those, patient satisfaction, all those points. So just make sure that you're using those words, and for that, obviously, you will need to know those core competencies, those core principles that we just talked about in the previous meeting. So yeah, this is the same example: a patient not agreeing to our plan of care, team, plan, listen, concerns, address, non-judgmental, extra time with the patient, your resources. So another thing that I used to say in that example was, if I just told him that it was anxiety, he went home and he was not satisfied, he would come back again. And that would cause a healthcare waste. A patient using healthcare resources again and again, but not being satisfied, causing a healthcare waste. Then patient education, very important term. Always they want to hear this: patient education, patient education, patient education. Always use this in those difficult patients. Motivational interviewing is a technique. If you read more on it, you will find what pointers you can also use in your explanations, and then use them. Also, this is a good real world technique. Also, summarize what did this difficulty teach you. At the end of every question like this, you have to summarize in the end that, through this difficult patient, I understood the importance of a thorough communication and how it can change the whole encounter. So yeah, this is what I learned. Any questions? No? Okay, next. Why internal medicine? Very common question. Everybody uses this examples, and I think this is a good categorization of what internal medicine has: comprehensiveness of care. Now, how you explain this comprehensiveness would be different from each of you, in your experiences, in your home country experiences, US clinical experiences. So you can always gauge your experience and then terminate it with this line that this comprehensiveness of care is what attracted me to medicine. Then different subspecialties, you take care of different problem solving, population health, environment. Now, population health care is a thing that is rarely touched by a lot of candidates. You should always use this. This is one of the things unique to internal medicine. You talk about a heart problem, you talk about a cardiology or nephrology, gastro, those are already different specialties. But population healthcare is something that is just intrinsic to internal medicine. So always use some form of it. I'm sure you have worked in rural healthcare centers and volunteer centers. So what is population health? It's basically, strategies to improve health outcomes in a population. And those strategies could include increased surveying, making sure they have increased resources, education, just simple things like, telling someone the right diet for hypertension, or telling someone that they have to be screened for obstructive sleep apnea, and that is what is causing them decreased energy levels during the day. So in our countries, dengue things and COVID-19, so those can come in population health. Read more on it. And this is the term that I was saying has those three things: patient centered care, evidence, and quadruple aim. So learn more about it and talk about it. And then happiness. Yeah, you have to give a personal touch to it too. Don't just be mechanical about it. If it brings you happiness, say, it gives me clinical confidence. I know that I am more, fulfilled when I rightly diagnose a patient, or when I solve something for someone. But even care coordination, not necessarily that you have to be, some torchbearer of Nobel Prize winning technique that you invented. It can just be, I just found the right resources for the patient. I connected him with the right neurologist, or I connected him with the right interventional radiologist, and that's okay. So it doesn't have to be groundbreaking. So just say that, that's what you did. So give a personal touch too. So yeah. So the next thing is, every interview will ask you in the end, any questions for me? Never say I don't have any questions, because always have questions. Have at least 3 questions. because 3 sticks to memory. And those questions should be smart, and they should touch the areas that have not been touched during your interview. Some interviews will be so fast, they will just ask you, tell me about yourself, and then they'll be like, any questions for me? And you'll be like, I didn't even talk about my US legal experience. There's so much research that I've been doing, or I invented something and they don't even want to talk about it. So that's the time when you want to be smart about it and make a question that tells them about your hidden something that you want to share also, and then also poses a question. Let's say, for example, you say, I worked in population healthcare management. I increased the health outcomes in the Brooklyn population. That's where I got interested in population health. Does your program have any resources to improve population health outcomes in your area? And they will. They will always have resources about it. They will tell you, we organize mobile clinics, our outpatient clinic is like this. Then that they will know. Through this question, you have told them that you know the important aspect of internal medicine in their country, and you're also giving them food for thought if they don't have it. So this is an important thing again. Secondly, another question that I used to ask is, what is the balance between autonomy and supervision? Now, these are just like, everybody will ask this, but it's okay. You don't always have to be a unique questionnaire. So, and every program is different. Some, start in the end of 6 months, sometimes 1 year. So autonomy and supervision is a very variable thing. So then you can ask about your favorite domain, inpatient, outpatient, assess on IM milestones. I think these are very specialized questions. Someone told me to ask this, but I have always found it hard. But if you find a way to ask, you can say how you assess your residents in internal medicine milestones of patient care or medical knowledge. And then they will tell you that, ACGME has milestones, and you can also read them on their website, ACGME milestones, that a medical knowledge has to be in this level in first year, second year, and third year. And you can ask them, how do you assess your residents in the core competencies of interpersonal skills, for example, or what other things they have in their program. So yeah, these are the few examples. So yeah, any questions? This is an open field now. You can ask if anything that you want to make a question of. You say that, I did this in my career, but I'm unable to tell them in the interview, or I have difficulty telling them in the interview. You can ask me.
Right, Dr. Raheel, I have a question.
Sure.
There's a very pet question that many people say that that you're going to be asked in your interviews for, and that is like, how would you define your weaknesses? Like, what's the best way to respond to that question?
I have a few weaknesses. In all other questions, say I have several strengths, but then say, yes, I have few weaknesses. And then you can say, one thing that I realized during, as I said I think it's one of the slides also, it has to be benign. If you go back to those slides of weaknesses, Ahmed, can you go back?
Yeah, sure. Yep, here it is.
So it has to be benign, not something so strong that it comes off as a red flag. And benign time management is something that we all struggle with as doctors, as medical students, and everybody has a different technique of solving that. Now, I'm not saying everybody should say that my weakness is time management. You have to say it in a way that what is personal to you too. Let's say you were preparing for your Strep 3, doing a job, taking care of your family, finances, and I think that's where you identified your weakness, which was your time management. Now that is more personal. Instead of saying, I have problems managing time, so I just make a to-do list, I have my alarm clock, I exercise, and I study at this time, and that's how I solve it. Now this is very mechanical and looks fake. So make it personal. Say, what you did in that time. I found time for personal wellness. I felt like if I was studying the whole day, it would drain me so much and I was not able to efficiently perform. And hence I devised a plan. What was your plan? I planned that I would set aside time for studying. I set aside 30 minutes for meditation, 30 minutes for this. And I realized the importance of personal wellness. And this wellness is also an important thing that they want to hear. So that gives, again, some pointers to you. And then, you can always then, stepwise go to how you solved it and you're working on it or something like that. Does that make sense?
It definitely does. Thank you so much for answering that.
No problem. Any other questions?
Yes, I have a question, Dr. Awan.
Sure.
So I was like wondering how should we address any questions about gaps or something that is in the CV or the application that we have that is kind of a red flag, like gaps or maybe a late graduation year or something that we don't have a US experience, because I'm sure it's gonna be brought up, and we need to be tactful about answering it so we don't
Yeah.
seem like we didn't do our effort to do our best.
Sure. Firstly, believe that it happens and it's okay. Secondly, tell me, is the gap really gap, or is it something that was filled with some sort of experience in your home country?
It's not for me, but for my friends, some of them had some gaps, and they were working, getting some money for the USMLEs and stuff, but it was difficult for them to find something that is medical in the US, and they just have some maybe
Or jobs, you're saying, not medical stuff that they
yeah,
filled it with?
yeah.
Oh, to be honest, I don't have an answer for this, because a gap that is not filled by anything medical, it is hard to gauge it. But you can always say that I was working on some research project or something educational. And I'm sure there's something that you can fill it up with, like a research paper or some volunteer activity that you did during that time. And obviously, it won't justify like years and years of gap, but it will give them some idea. And then another thing is, if it is a personal, some calamity struck, someone's in an accident or some tragedy happened, you can always sell that, I came back stronger. I learned from this. There was a gap, and I realized that I did not give up on that. This is a life story. You can actually make it into something positive. Say, I had this gap, I had financial problems, and I was just verge of giving up, but then I realized why I came into medicine was to help others, and I would not let that opportunity go, especially with all the knowledge that I had. And hence I started collecting money for this process. And I was studying meanwhile, and in the end, even though it was nerve-wracking, I made it through. And I learned from this process that through perseverance and consistency, anything is possible. So that's how you can gauge it.
Thank you so much for the answer. I have kind of a follow-up question on that, and
Yeah.
it's like, from your experience, how big of a deal is something like the not having a US experience or having a gap in the CV? How big of a deal in determining if you rank or not in the program?
I think no one factor can determine if you are being ranked or not. Having said that, having no clinical experience definitely gives you a negative mark, because then you are not able to connect anything with the US clinical experience, and that just doesn't reflect well in the interview, unless you are really good at something that you did in your own country and you have using the same principles that they use here. Then you can reflect that in your other, your home country experiences. Gap wise, I think if it's medical, it is very justifiable. There is no shame in saying that I worked for 5 years in my own country. You were working there. There were so many things you dealt with, so many things you learned. You will be an asset to their program. And I am an example for that, because I come from a rich home country experience, and it has translated to a great repo in my own program. So I feel like this is something not to shy away from. It is actually something to shine into, and say that I work in so diverse healthcare systems, so adaptable I am, and turning that sort of perceived red flag into a good positive pointer. So it's just how you believe it. If you keep telling yourself, oh, I am this and that, that person was 2022 graduate and I am like 2015 graduate. If you believe like that, it will show in your interview. And that was my first slide. You have to not believe it and then and practice it. I know it sounds easy when I say it, but I actually wrote my answers down and I made sure that I'm saying that reflects that sort of mindset, that I am not ashamed of this. I am actually proud of, all that time that I've spent, and it reflects so much of consistency, so much of hard work, and so much of learning throughout the process. I don't know if I'm answering your question, but I think that's the best I could come up with.
Yeah, it's a beautiful answer. I think what I got from it is to own what I have and just to make it work for my benefit. I have one last
and
question.
use what they want to hear. It sounds philosophical, but then you have to be, they don't exactly want to hear this. What they want to hear is those core principles that we talked about, medical knowledge, patient care, those principles. So always gauge those things. If you did something medical, find examples for those principles.
I see. I have one last question, and I'm sorry, everybody. I've been asking a lot of questions, I know.
It's okay.
What do you think we should be doing in the next few weeks or 2 months preparing for the interview? What is a best game plan for us?
Make a list of 20 to 30 programs, your favorite 20 to 30 programs. Make a diary, a mass diary, write those things. Go to their websites, find their residents, find their faculty, aggressively chase them, find them on LinkedIn, find them on Twitter, find them on emails, send them emails, repeated emails every week or every other week. I would say those 20 to 30 every week. The rest you can send 2 weeks or 3 weeks, I don't care. But those 20 to 30, and that includes the programs that you have signaled. Chase them, tell them about, make a good email, highlighting not too long, but highlighting all the things that you want to share. Be smart about it, and then chase them here and there. On LinkedIn is a very good thing. I got an interview through LinkedIn chasing. So be aggressive about it. Those 30 programs, you should definitely think that I want to get at least 5 to 6 interviews through these chasing. And it is possible. 2 to 3, definitely possible. If you do this aggressive chasing, those 20 to 30 programs. And then, emailing, finding contacts. I know it's nerve-wracking. Just make sure if you're in US, travel, call people, the advantage of calling people on weekends and reminding them, please, or whatever you can do.
Thank you so much.
No problem.
Doctor, sorry to cut in again, Dr. Raheel. So we are left with like 8 minutes now.
Okay, sure. Any other questions, guys? Hello, Surek. You are unmute, so I'm confused if you want to ask the question, or is it just that you're just unmute? Oh, Surek just left. So
sorry, sorry, Dr. Awan. Yeah, I don't have any question. Everything was great.
Happy to see you here. All right, I wish you all good luck. I will upload these things on my LinkedIn and on my YouTube channel, and then you can watch them. Good luck with everything. Just stay persistent, be positive, and have a good day, all of you. Thank you, Ahmed, for organizing this.
A good one.
Thank you so much, Dr. Raheel,
Thank
for
you.
giving us your time and helping all of us out in this, stressful period. So
No problem.
Thank you so much.
Happy to help. Take care. Bye. Allah
Thank you.
Hafiz.
Allah Hafiz.